day, COVID-19 turned our lives upside down. But thankfully, March 10th, 2021 was the day we got hope that the pandemic will end. With the COVID-19 vaccine now being available to Jamaicans across the island, it means that very soon we can get back to normal. These vaccines are both safe and effective and will ensure that you and your loved ones are protected and can get back to the things you love most, like partying, going to church, like family dinners, like simply giving your mom or dad a hug. I have been vaccinated and I am encouraging each and every Jamaican to take the vaccine when it is available to your group. Let us put a stop to the COVID-19 pandemic. Let us get vaccinated so we can get back to life.
Good evening, ladies and gentlemen, members of the media. Thank you so much for joining us for the Ministry of Health and Wellness's COVID conversation for Friday, March 26. The Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, is joined this evening by the Permanent Secretary, Mr. Dunstan Bryan, Captain David Chingfong, Inspector General of the Jamaica Defence Force, and Senior Superintendent Marlon Nesbeth of the Jamaica Constabulary Force. We'll begin this evening's conversation with the update from the Minister.
Thank you very much, Stephen, and good evening, ladies and gentlemen, on this Friday evening. Thank you very much for joining us. Thanks to members of the media, and I want to just specially welcome Captain David Chingfong, Inspector General of the Jamaica Defence Force, and of course, Senior Superintendent Marlon Nesbeth of the JCF. Both very important individuals representing very critical organizations for the topic that we are going to discuss this evening, which is our Blitz, the first of its kind in the three-phased approach to rolling out our vaccine program. And, they're going to be absolutely critical as part of the partnership that is necessary to respond to COVID. Of course, the usual suspect is beside me, the Permanent Secretary, who will speak momentarily. So this evening, we want to share some specifics around the first vaccination blitz, which will happen tomorrow. That's tomorrow, Saturday. And to add a few comments about the upcoming week. So as of Thursday, March 25th, 2021, a total of 33,642 persons in Jamaica have received the first dose of the COVID-19 vaccine manufactured by AstraZeneca. In week 2, we exceeded our target with some 11,430. That was the target. We vaccinated 13,244, or approximately 16% above target. We're currently in week 3, and so far we are at 22% of target. The overall vaccination numbers, 33,642, represents some 71% of the target for the month. So all in all, I think we're doing well. We're on track. We have exceeded the past week's target, and that is a good sign for the demand for the vaccines, which is very important. On Monday, March 22nd, we began accepting appointments online via telephone for persons 75 years and older. We will continue vaccination for this age cohort for the upcoming week. That is the week of March 29th to April 2nd. Members of the public who are 75 years and older must, and I say that with emphasis, must make an appointment before visiting a vaccination site. Very, very necessary that you make that appointment to avoid confusion, to avoid long waits, particularly at the age of 75 or senior citizens. We do not want you to go there just waiting, because it means that you, even if you were to get through, and we do try to accommodate, it's just not good for you to be waiting for extended periods, perhaps in an environment that is unpleasant. So we say make the appointment. Once you come to visit the site, you'll be asked to present a government-issued ID or a letter from a justice of the peace testifying to your age. And justice of the peace are all over the country, in every community. They know the local community, and so we believe they are the best ones suited to provide some validation or verification of your age. So you can speak to your local justice if you don't have any form of ID. We will announce each week, as we have been doing, new priority groups that will be vaccinated along with the existing ones. Now let's turn to the important matter for today, the issue of the National Vaccination Blitz for tomorrow, Saturday, March 27th, 2021. So this Saturday, tomorrow, we will execute our Blitz operation. It will take place at the National Arena here in Kingston between the hours of 10 a.m. to 3 p.m. The aim is to inoculate, or to use a term better understood, to vaccinate about 1,000 persons approximately. So that's the desire. And so we are prepared for that. We're prepared for that in terms of the vaccine shots. We're prepared for that in terms of the infrastructure, the personnel, the layout of the location. Persons are reminded that they must come with appropriate protection, meaning their masks, and where you can take your hand sanitizer, please take your hand sanitizer as you would and as the protocols have been dictating as we go about our normal operation. So please wear your mask, have your sanitizer, and come prepared to be around others, but we are trying to arrange the location to ensure that you are protected, but the mask clearly will give you additional protection. The entire vaccination process we anticipate will take 1 hour. But I think it's important that persons are prepared to spend at least 2 hours at the location. And that is important because there may be cases of some wait, whether at the entrance to the facility or when you're at the facility or during the observation. You may have to wait a little longer for whatever reason. You may have some bottlenecks periodically. So be prepared to spend at approximately 2 hours, although ideally we would like to see the process take you an hour. Each 75-year and older person who have been given an appointment will be allowed to have one caregiver to accompany them. So we do appreciate that some persons at that age can go on their own, but we also appreciate that more often than not, persons are going to require assistance, support of one form or another. And so whether it is a family member, a hired help, or otherwise a driver, each person is allowed one caregiver. We say one because more than one means more people, and we're trying to minimize the crowd unless it is absolutely necessary. So you're allowed to have one caregiver. We will provide minimum refreshment, water. So if there's a need, if you get thirsty, we provide water for you, and certainly for those who are there with appointment. If you think you need to carry something else out of necessity based on your particular condition, then clearly we would encourage you so to do. But we will provide water at the venue. And the intention is to make the location as comfortable as possible. You know, I just came from there with the team. We have put out tents, chairs, directional signs, and there will be a number of persons supported by the JDF and JCF, of course, to provide directions and answer questions as the case may be, of course, with the health team manning the arrangement. We expect approximately 70 doctors to be on hand, public health nurses, and community health aides from the Kingston and St. Andrew Health Department and the Southeast Regional Health Authority, that's SARA, All will be on site. They'll be very visible. You know the uniforms that they wear. And they will provide a number of functions, not just the actual, application of the vaccine, but the counseling, and just be there to provide help and support, to give advice. In addition to that, we will have wheelchairs to provide support to persons who are not mobile or who may have difficulties, and of course, persons to man those devices. The JDF and the JCF are absolutely critical to the execution of this arrangement. They are going to, first of all, they've helped up to this point in laying out the facility. They have significant expertise in logistics, but also in managing people and people movement. And of course, they are empowered under law to enforce the rules of engagement. So in terms of entry and exit, where you go, when you go, how long you stay, where you stay, they're going to provide critical support to the health team to ensure that we go as efficiently as possible and that the day runs as smoothly as possible. And for that, we are very grateful. So the JCF will manage the logistics on the compound as well as on the road, and the JDF. On the road, entrance to the facility, the exit, and other stations within the vaccination center. I really want to express, having been a part of the conversation and the planning with the health team, the permanent secretary and others, our appreciation to the JDF and the JCF, because they have really come on board in a very fulsome way. And I'm very confident that if we all follow the rules and comply with the rules of engagement, then I think it will be a smooth day. And I would really like to see us get to as close as possible to the 1,000 persons, because tomorrow is going to be a sort of a pilot, if you will. We are going to be observing carefully what we have laid out. We're going to see where the kinks are, if there are any, where adjustments need to be made. We will be flexible tomorrow because it's also a learning process. And remember, depending on how it goes, we will perfect or improve the process as we roll out these Blitz activities across the country. The intention is to have them in every parish over an extended period of time once we have the vaccines, so that we can do as quickly as possible more of the population. So tomorrow is an important day, not just to execute the application of vaccines to our 75 years and older residents. It's also an important day to learn from the experience and to make necessary corrections where we have to make them. From that perspective, and in closing, and then I'd ask the PS to just show us the layout of the process flow. I want to say to persons, don't come if you are not slated to. And secondly, be prepared if it happens for some delays, and where instructions are given, we encourage you to follow those instructions. We do recognize that 75 years and older is a delicate period in one's life cycle, and therefore we'll provide as much support as possible to that vulnerable community to ensure that they are given the best possible care. So thank you very much. I'm going to ask the PS now to quickly go through the process flow, and then we'll entertain questions. PS.
Thank you very much, Minister. Captain Chin Fong and Superintendent Nesbeth, thank you for joining us. Minister, the team, the clinical team, and the support teams from the different organizations that are providing the support for the implementation have worked over the past month to execute this activity tomorrow. As you rightly said, tomorrow will be a pilot. We will be running several assessments, time and movement assessments. We'll also be doing some customer sensitivity assessments, and we will be testing several different intervention strategies for the implementation of vaccinations in a mass setting. So tomorrow we begin and the process through our entrance, and if you drive, we will have 3 checkpoints. There will be a checkpoint at the intersection of Arthur Wint Drive and Mountain View Avenue. So there will be barriers put up at that checkpoint, and persons at that checkpoint will be simply asked whether or not they're there for vaccination or they live in the facility that is close by. Checkpoint 2 will be the checkpoint now where persons will have to show evidence of their confirmation of appointment. And this evidence is either by text or a printed email that they would have received from the website. Both checkpoint 2 and checkpoint 3 will do the same transaction. However, at checkpoint 3, you will not be allowed to drive your vehicle through that checkpoint, but you will be asked to make your way to the checkpoint 1, and because that's where we are allowing persons to enter the facility. Next. Once you come through the checkpoints, the car park, the stadium car park, is what we call our staging area. And this area is where persons will be assessed to determine whether or not they're at the right time for their appointment. So if you have a 10 o'clock appointment and you arrive at 10 o'clock, you will be asked to go to the front of the car park closest to the arena. However, if you have an 11 o'clock appointment and you are there early, you will be asked to go to the back of the car park, closer to where we call the back there. What you call it? That place where they keep carnival stuff. Mass camp. There you go. Right. So you'll be asked to park at mass camp. Once we have cleared the persons who are on time for their appointment, then persons who are early will be asked to move to the front of the car park. Once we have done that, we move next. Persons will then exit the gate closest to the arena, and they will drive around the road and come back up alongside the National Arena front entrance. And there will be 7 drop-off points at that front part of the arena. Over 20 attendants will be at that point to assist persons who need any assistance to a receiving area that will be at the front of the arena. Persons in vehicles, the caregivers, will then be asked to move along to the parking area, which is over by the indoor stadium. Once they have parked, they return to the receiving area at the drop-off point, and then they meet up back with the person to be vaccinated, and they proceed into the arena together. If persons are alone, if they have taken themselves, they will not stop at the drop-off point. They will just proceed to parking and then enter the arena through the front. Next. If you walk, then you will only be able to enter the facility or the grounds of the arena through the main gate. The drive-through gates where we have the car park will not allow walk-in persons. Pedestrians will therefore go through the front gate and then make their way to the front of the arena. Now, at that checkpoint, which is checkpoint 4, for pedestrians walking, They will be checked by the security officials for their appointment, and they will be checked for the confirmation of their appointments for that day and time. After that has been done, they will proceed to the front of the arena, next, to the same venue where you have the drop-off point, where they will be checked to see whether or not they are there at the right time. Now, if they have arrived at 10 o'clock and they have an 11 o'clock appointment, they will be accommodated in the reception area at the front of the arena. Next. Now, once you enter the arena, next, the facility is set up in groups of 50. And there are four groups of 50, where persons, 100 persons, 200 persons, will be accommodated within the facility. Once you sit at a point in the facility, all of our services will be provided to you at the point where you sit. That means we will provide you with your registration services. We'll provide you with your counseling services. We'll do the vaccine administration, and we will do our observation and documentation services, where you'll be provided with your vaccination card, all at the same point. This is to minimize movement, and also based on the target group that we are treating with at the venue, to ensure that we limit movement and maintain social distancing and infection prevention and control. Next. Once we are complete, persons will exit the arena through the side gate, and they will be picked up at the parking lot, and they will exit through the VIP car park exit point. And that is the end of our process. Now, some simple reminders. Please take with you your government issued identification or your letter from your Justice of the Peace. Ensure that you have your text message confirmation or confirmation of appointment. Very important, Minister. If you are ill with flu-like symptoms, stay home. If you are ill with flu-like symptoms, you will not receive vaccination at the time that you have received your appointment. We will ask that your appointment be deferred, and you will be another appointment will be made when you are well. Come to your appointment at the time slot that is specified. This is to manage the crowd and reduce your wait time. And of course, obey the instructions of the officers that are assigned to the center. Thank you, Minister.
Okay. What was just said may be a little difficult to digest for persons who may be hearing it, would be hearing it for the first time. So let me just, before we go into questions, just reiterate what is most important, I think, at this point in time. What is most important is that you should come once you have an appointment. Try to stick to the appointment time. So that text that you would have gotten that says 10 or 11 or 12, try to come as close to that time as possible. Wear your PPEs, your masks, and if you have your hand sanitizer, so you come prepared to maintain the protocol. Once you get to the entrance of the facility, starting at the top of Mountain View, where you turn to come down to the facility, you will have a barrier there that provides appropriate instructions, whether checking or directing you as to where else to go. And from there on end, you will get instructions as to what to do, where to go, where to sit, how to move from one place to the next. So For the person listening on who should be there tomorrow, come if you should be there. Don't if you should not be there. Wear your PPEs and come close to the time or at the time that you have been given, which will make it easier for us to process you and to provide you with instructions to move from one phase to the next. And as I said earlier, you'll be allowed a caregiver to accompany you. And if I'm speaking to the caregiver, then I'm saying only one of you should come with the individual that you're taking. And you will also be there when those instructions are given, so you can provide support. If you need any essential item, medication, or anything that is necessary for your upkeep over the period of time that you may need to be there, up to 2 hours, possibly, then take it with you, but we will provide water on the compound at the facility. I think those would be the sort of most important basics. Beyond that, we will guide you on the process, and it will be fairly easy. All right, Stephen, any questions?
Thank you very much, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom to pose their questions. We're going to begin with Althea Saunders from the Jamaica Observer.
Hi, good evening. Are you hearing me?
Yes, go ahead, please.
All right, just a general question on vaccination. Is there any indication at this point that persons who are COVID positive could have severe side effects from getting the vaccine? And generally, should persons ideally do a COVID test before they are vaccinated?
Yeah, we don't have a clinician here at this briefing. We do normally at our regular COVID conversation, so I don't want to venture into giving advice around clinical science, except just to reiterate what I've heard from them in the past, which is that you are assessed leading up to receiving the vaccine, and that assessment determines whether or not the vaccine is applied, which is why the PS said if you're not well, don't come. Beyond that, we give a report on side effects, both prior to the vaccine being administered, what the possible side effects are, and how to treat with those, and that is contained within a pamphlet that's given, as well as a report on adverse reactions after it has been administered, and that data is available and collected. And we have given a report on that to show very low numbers of any sort of adverse reaction. And adverse meaning, throwing up, getting dizzy spells, that sort of thing. Beyond that, I don't know, and not been told, and in fact been told the opposite, that the vaccine is safe and it is administered globally currently. And I don't know that any country requires a COVID test prior to the vaccine being administered. That may or may not help you, but if you want better particulars, I would prefer you to speak with the clinicians on that. Okay, thank you.
Thank you very much, Minister. We're going to go to Debbie Ann Wright from RJR.
Good evening. I'm trying to get some further information on what our options are for more doses of vaccines, given we're having now a Blitz, and there are uncertainties around supplies. So what are the options being looked at the moment? I think Althea asked my other question, so I'll just wait for that.
Okay, so the Blitz was always a part of the plan, and over time it was to start slow and then gather momentum over time, and as vaccines become more available. And so there is a recognition, even with tomorrow's Blitz, that there are challenges in the global market for vaccines, which is why we're having one as opposed to several. And we are budgeting, if you will, for a certain amount, which is in this instance up to 1,000 doses. As was said in the earlier statement I made, we have administered to date about 33,000 or thereabouts, which is approximately half of the stocks that we have. We have up to 64,400. And so we do have stocks to last us a few more weeks, maybe 2 or 3, depending on the take-up. And we will moderate the programs we have over this period. There are ongoing efforts to secure additional supplies. We were promised to get an additional supply under COVAX, 26,000 doses in the first week of April. And there are discussions taking place with a number of other possible suppliers and manufacturers for other amounts to be had during the month of April. It is, however, challenging, and I don't think we can shy away from that. You would have seen this week where one or the most significant manufacturer of vaccines, India, announced the restrictions on export. It's really a formalization of a process that had started weeks before, where Europe, the US, most of the countries where you have manufacturing bases for vaccines or where these brands are registered have taken a posture to support their local population first. And in many cases, that means them restricting the exports. And so vaccine nationalism is real, and it does undermine the concept of vaccine equity, which is something that COVAX was intended to achieve, but now has become a victim of because they can't get the supplies. So we could see some fallout in terms of late delivery, certainly over the next month, perhaps even month and a half, based on this posture. I do believe, though, that over time, given that a number of vaccines are in clinical trials, over 80 vaccines, quite a few are now being considered at the WHO level, you will see additional brands coming on the market over the next month to 6 weeks and production going up, and you will start to see a freeing up of the market with time. But the real challenge is over the next month to 6 weeks, and we have to manage that, but we'll keep the country informed on where we are. And if we have to suspend for a while, then we will just have to say so. It will be regrettable, and we're hoping not. But it is a possibility. Let's hope that it doesn't occur. As an addition to the question that was asked earlier about the effects of the vaccine on individuals and the severity of the effects, we do take note that there have been talk in the public space that persons have had very adverse reactions to the vaccine, even to the extreme. We do not have any evidence of that. We have seen in other jurisdictions where those claims have been made and then retracted. The overwhelming evidence supports the view that the vaccines have been tried, clinical trials, and deemed safe, and persons, for the overwhelming number of cases who have taken the vaccines, have had little or no adverse effect. And so we continue to have confidence in the vaccine and in the process.
Thank you very much, Minister. Natalie from IRI FM is asking, what happens if an elderly is very late for the appointment time? Do they get it the next day, or do they have to reschedule an appointment? Well,
very late, as long as the day is active and persons are being registered, then it means that if you turn up even after your time to turn up, we will work to accommodate you. What it does mean, though, is that you would create some amount of disruption to the normal flow of things, and it may mean longer wait for you. So we would prefer not to delay for another day unless that person turns up after we have closed off. But it may mean if you come later than the time that you have been assigned, that you may be asked to wait longer than normal. And that should be expected.
Thank you, Minister. We're going to go to Cassius Watson from Jamaica Social.
Hi, good evening, folks. Thanks for facilitating me. I have two questions. Both of them may be for the permanent secretary, and or the minister may choose to handle one. The first is, are there any considerations for the Johnson and Johnson vaccine, which is a single jab vaccine? And I ask this in the context of many Jamaicans are already, leaning into the anti-vaxxer camp and are worried about having to be jabbed twice. I suspect a single jab would help the cause. Any considerations there? And the second question is regarding the national arena venue. Will there be tents set up internally? And I asked that will the areas be so separated that people will feel safe, that not too many people are in. How many people are you planning to accommodate in the arena, on the arena floor at any given time? Thanks.
On the first question, yes, the Johnson & Johnson brand is part of the arrangements that we have made. Certainly under the African platform, they have indicated to us that a part of our allocation will be Johnson & Johnson, which I agree with you makes things a lot easier for us and for those who are receiving the vaccine, because it's a one dose or one application. So both the jab itself and the administration of the process would be easier. So to the extent that we can get that brand, we would certainly accommodate it, and we have been told that we will get some of that. I can't say when; it depends on supply. The issue of the layout of the grounds, both external to the building and internal, there are tents on the ground now that have been put up, chairs laid out, and in the arena itself, there are partitions depending on what functions are being performed in a particular area. As it relates to the layout of the seating, it is sufficiently spaced to accommodate the caregiver and the person who is receiving the vaccine, with a sufficient space between them or the other group or individual. We have taken care in the planning to avoid those persons moving around too much. So once they settle in at that location on the inside of the building, they are given all the services until they are ready to exit. And there is a process flow that has been worked out which allows them to exit in a fairly efficient manner, recognizing the possibility of limitations, persons with walking sticks or in wheelchairs or just walking slowly. So all of that is accommodated. The arena, as you know, is a fairly large facility, so we anticipate that perhaps at the peak you may have 200 persons inside. That's a facility that can accommodate thousands. So it's for us it's safe or relatively safe, and it's being laid out to ensure that there is no need for too much commingling, if you will. Similarly, we will equip the facility with fans to push air outside of the building as opposed to circulating within the building. And as I said when I started, persons are advised to wear their masks and have their sanitizer as they would when they go about their regular affairs under the current protocol.
Thank you very much, Minister. There's a follow-up from Debian, right?
Following up on
We're not hearing you, Debbie.
received. Are you hearing me now?
Yes, go ahead, please.
Right. I'm saying, given the uncertainty surrounding the availability of vaccines, is there a possibility that persons who have already received their first dose and have been given the AstraZeneca might get a different vaccine for their second dose?
Right. So the clinical advice on that, and again, I'm not a clinician, I'm just reiterating what they have said or repeating what they have said, is that you stick to one dose, one brand. So if you got the AstraZeneca, then you need to get the AstraZeneca for the second second dose. I don't foresee us not being able to have the second dose, given that persons are given up to 3 months, 8 to 12 weeks for the second dose to be applied, because I really do think that the market will adjust globally. I'm certainly hoping for that. There's always an outside possibility that it may not happen, but I think based on what is happening in those countries that are supplying, are prioritizing their own population, I think they're moving at a pace where we could see some freeing up, as well as based on the fact that other brands will come on the market. And there's an expiry date to the vaccine too, so persons have to use it within a reasonable time or it could expire. So I don't anticipate that, but if we are approaching that, we will make it known to the public. What is important to note, though, is that you are not at a disadvantage. You would have already gained some advantage, let me put it another way, if you had one single dose. I'm told by the clinicians you get up to a 30% or somewhere there about protection, and then the second dose would take you up to the higher levels. So the fact that you have gotten one dose is better than not getting any. And the fact that you have gotten one dose, even if you had a delay in getting the second, you're still better off. So, we are looking at these things in degrees of benefits, if you will. But I do believe that we will get enough to give the second dose during the period of time that is allowed.
Thank you very much, Minister. Our Chief Medical Officer has joined us online, and she is going to respond to the question from Alfia. So Alfia is asking, are there any indications at this time that persons who are COVID positive could have severe side effects from being vaccinated? Should persons ideally do a COVID test before taking the vaccine? And we ask our CMO to respond.
Hi, good evening, everyone. So there are no indications at this time that persons who are COVID positive could have severe side effects. What we're asking is that persons who are having symptoms, certainly if you know that you are COVID positive, then you should be quarantining or you should be in isolation at home or in a facility. And so therefore, we would not expect you to be coming out for vaccination if you know you are COVID positive. If it is that you are symptomatic and you do not know if you are COVID positive, but if you're having any kind of flu-like illnesses or respiratory illnesses, we would ask that you stay home. Once you may end up seeing a doctor who may request a test to be done, and if found to be positive, then you would be in isolation. Once your symptoms have settled, once your quarantine period or isolation period is over, then you are able to take the vaccine.
All right, thank you very much, CMO. Minister, that's all the questions we have from the media. I'll just hand back to you for your closing remarks.
Okay, thank you very much. And let me just begin by thanking Captain Chin Fong and Senior Superintendent Marlon Nesbitt for being here, representing their respective organizations, and for the efforts that have gone in and will go into tomorrow's execution, the PS, the CMO, and the staff, Sarah, other healthcare workers who have put in a lot of work to get us to this point. I want to say thanks. Just a reminder again, tomorrow is our first Blitz. We're hoping to do 1,000 persons. You should have an appointment with a time. Please turn up at the National Arena. You'll be directed once you get close to the facility, whether at the top of the road or closer to the gate, and you'll be given instructions around verifying your appointment, directing you to do certain things. So follow the instructions, wear your mask, carry your hand sanitizer, any other essential that you may need for approximately 2 hours of wait, and you're allowed to come with your caregiver or one caregiver to assist you, recognizing that you may have limitations. We have wheelchairs on site, so those will be provided. In the meantime, I want to just extend my appreciation again on behalf of the government to the team in the field who have been working very hard to inoculate the population in groups that have been outlined. Since yesterday, I've been in Frankfield at the health center there, Northern Clarendon, Maypen Hospital. We went to Mandeville, then to Balaclava in St. Elizabeth, then to Savlamar at the health center, and to Grange Hill. Came back this afternoon, this evening, and all seems to be going well in terms of persons coming out for the vaccine. That is the 75-year-olds who have appointments. There were a few things that I think we have to adjust a bit, where we have, and I do believe we must recognize our weaknesses, and nothing is wrong with saying it as long as we work on correcting it. Where we have health centers where other services are being provided while we're applying the vaccines, there tends to be some gathering that we may need to manage a little better by separating the groups, and that may mean putting in an extra tent because persons are waiting, and especially at this age cohort, you want persons to have a chair, maybe a tent somewhere that's cool, maybe a little water as we are providing tomorrow, because it can be difficult for them. But that is, to my mind, minor points or minor recognition of challenges. I think for the most part, the team have been doing exceptionally well, and people are in fact appreciating it. Got a lot of thanks from senior citizens who are very appreciative of what is happening. And I'm sure the rest of the country, the team is doing the same thing. So I want to really say thanks and just ask Jamaicans, please, it's a difficult time for us. We're batting on several fronts. I do take note on social media the concerns and the uproar, justifiably so in the country, around the unfortunate, untimely, and bastardly act that led to the tragic killing of the young lady in the Portmore area. And, I want to express my own condolences to the family members and friends, and to say, where will it all end? As a country, we really have to take stock as a people and recognize that all of us have a role to play. The government certainly has a role to play. I see the criticisms online, even against the healthcare team. And we appreciate and understand fully why persons are outraged, are upset. It really is a time for self-reflection and reconciliation, and a call to action by all of us as we seek to overcome not just COVID and the impact it is having on us as citizens. I've lost many persons every day, and they all have family members, and the health team are distressed and fatigued. So there is a lot of pain to go around. We have to redouble our efforts. We have to come together as a country and push back on those forces of evil wherever those forces reside. So thank you very much. Try and enjoy, or at least reflect on this shutdown over the next couple of days, or partial shutdown. It is for a good cause. It is about getting us back to normal, and we have, all of us, a role to play in that regard. Thank you, and God bless. If ever there was a time to take care of your mental health, it is now.
Now, when your physical health so clearly impacts your emotional health.
Now, when we need to talk and listen to each other.
Now, when supporting each other means survival.
Now, in a time of COVID-19.
Speak up.
Speak now.
Beat COVID-19.
Call 888 New Life, 639-5433.